In this session of Insta lecture, we try to understand the clinical manifestations of AML, acute myeloid leukemia, and we try to understand why they manifest in such a way. Now, the first key concept about the manifestation, clinical manifestation of AML is this, that AML, most of the clinical presentation is basically due to pancytopenia. You might be thinking that few days back I already told you that aplastic anemia also presents due to pancytopenia. Well, that is also true. Aplastic anemia, the presentation occurs also due to pancytopenia. But here, in acute leukemia, the pancytopenia is due to a different reason. In aplastic anemia, the pancytopenia was due to loss of hematopoietic stem cells by some autoimmune process or some drug mediated process or some infection. But here, in acute myeloid leukemia, the pancytopenia occurs due to a different reason, and we try to understand why. Basically, acute myeloid leukemia or any acute leukemia, the basic problem is two things. The key mantra in understanding acute myeloid leukemia is this, that there are two problems occurring. Some mutations are causing uncontrolled proliferation of the myeloblast. What are myeloblasts? Myeloblast is the earliest precursor form of the myeloid cell series. What I mean that a neutrophil start their life as a myeloblast, then they progress to promyelocyte, to myelocyte, then to metamyelocyte, band form and neutrophil. Just like us, like we start our life as a newborn, then progress to infancy, toddler stage, preschool stage, school going kid, teenage, mature adults, elderly, and then we breathe our last, we die. Similarly, a neutrophil's life also goes in this way. So, neutrophil's earliest stage, precursor stage, is known as myeloblast, or the myeloid series, cell series' earliest form of cell is known as myeloblast. And what happens in acute myeloid leukemia? This myeloblast start to proliferate in an uncontrolled manner. And secondly, they also lose the capacity for the differentiation. But the pancytopenia is particularly occurs due to the problem that there is an uncontrolled proliferation of this myeloblast. Now you can think the bone marrow just like this room. Some area of this room there are RBC precursors are growing. Some area of this room there are WBC precursors growing, and some area of this room there are platelet precursors are growing. The precursor of the platelets, megakaryocytes, are growing. Bone marrow, I think, is like a kindergarten school for the blood cells. They spend their early life getting trained, getting nurtured in this environment, bone marrow. And when they become mature enough, they usually go out to the peripheral blood to face the big bad world. Now, what happens in acute myeloid leukemia? Suddenly, one day, one of the myeloid precursor cells, one myeloblast, become cancerous and they start to proliferate rapidly, uncontrollably. They are just copying themselves one after another, from one cell to thousand cell to 1 million cell, 1 million cell to 1 billion cell. In this way, they are proliferating. Then what would happen? The normal population of the bone marrow, they would be crowded out, they would be eradicated, they would be destroyed by this aggressive proliferation of this myeloblast. And as a result, what happens? The normal population of the bone marrow, the normal RBC precursor cells, they die out. The normal WBC precursor cells, they die out. The normal platelet precursors from megakaryocyte, they get eradicated. As a result, the patients of acute leukemia, they present with bone marrow failure with pancytopenia. So obviously pancytopenia, I already told you that pancytopenia is equal to, pan means all, cyto means cell, and penia means poverty or decrease. So decrease in all three cell lines. So pancytopenia is equal to anemia plus neutropenia plus thrombocytopenia. So the patients of acute myeloid leukemia would also present with features of pancytopenia. There would be easy fatigability, tiredness, pallor, progressively increasing pallor due to anemia. There would be recurrent infections due to neutropenia, and that could also present with associated fever. And there will be recurrent bleeding symptoms, epistaxis, menorrhagia, gum bleeding. All this presentation would occur due to low platelet count. So these manifestations are all occurring in the acute myeloid leukemia, and as this leukemia is acute, so the onset would be rapid, stormy. This is an acute life-threatening condition if it's not treated properly, because it's an acute myeloid leukemia. So their presentation is quite fast and furious, I would say. And acute myeloid leukemia, all these manifestation, recurrent infections, fever, recurrent bleeding symptoms, they would develop within a span of few weeks. Unlike chronic leukemia, where you would get these symptoms spanning over months to years, but here it would develop within days to weeks in a very short span of time. Now, acute myeloid leukemia. So, in a nutshell, what we understood that acute myeloid leukemia typically presents due to features of pancytopenia. Why pancytopenia occurs? Pancytopenia occurs because in the bone marrow there is an uncontrolled proliferation of the myeloblast, and these myeloblasts are functionally defective also. They cannot mature into mature forms of the myeloid cells like mature neutrophils or mature WBCs or mature RBCs. So these abnormal cells are basically occupying the whole space of the bone marrow, and they are destroying the whole space of the bone marrow. It's like a foreigners come in a country and they invade or aliens come into our planet and they invade the whole planet and destroy the normal inhabitants, something like this, which you see in Hollywood movies. So the idea of acute myeloid leukemia, the key presentation is due to the presence of pancytopenia, which I already mentioned. The other manifestations which can be seen in acute myeloid leukemia is there could be some gum infiltration. So the patient, you should always check the oral cavity, because some forms of the acute myeloid leukemia like M4, M5, where there's a monocytic component is there, that could be gingival hyperplasia, gum hypertrophy. Then some AML could present with skin manifestation also. This is called leukemia cutis. Some form of AML could also present with a solid mass which is growing outside of the bone marrow. This is known as chloroma or myeloid sarcoma, which I already discussed during the classification of AML also. This could be a presentation. CNS infestation could be seen, but is less common compared to ALL, I'd say. And the other features which can be seen in AML would that it could also present with organomegaly like hepatosplenomegaly. It could also present sometimes with bone pain, but these things are not as common as ALL, acute lymphoblastic leukemia. Acute lymphoblastic leukemia we'll be discussing in some other lecture. So what do you understand that acute myeloid leukemia, they typically presents due to the features of pancytopenia, and pancytopenia occurs because bone marrow gets progressively occupied by this rapidly proliferating myeloblasts, which are the cancerous myeloblasts which are rapidly proliferating and destroying the normal population of the bone marrow. They crowd out the normal population of the bone marrow. And as a result, the presenting features are due to pancytopenia, due to anemia, due to neutropenia, and due to thrombocytopenia. So patients will be having progressive pallor, easy fatigability, recurrent infection, associated fever, recurrent bleeding symptoms. And there could be also presence with features of bone pain and organomegaly. And one point I forgot to mention, that some forms of AML, acute myeloid leukemia, particularly acute promyelocytic leukemia, could present with DIC, disseminated intravascular coagulation. What actually occurs that these promyelocytes, they release their granules, and that actually activates the clotting cascade and could initiate a life-threatening DIC, disseminated intravascular coagulation. And as I mentioned, this is quite common in acute promyelocytic leukemia, which is a specific subset of AML. And acute promyelocytic leukemia, due to other reasons also, there could be life-threatening bleeding could occur. But these things we'll be discussing in other lectures. Thank you very much.